Right, let's get to the next discussion. The Nigerian Association of Resident Doctors has declared a total and indefinite strike action over unmet demands after several meetings between or with the federal government had failed to yield desired result. Now, some of the major demands of the doctors' union are the immediate payment of the 2023 Medical Residency Training Fund, new and omitted hazard allowance arrears, skipping and implementation of corrected CONMESS in State Tertiary Health Institutions, among many others. Now, these are the issues generally. Joining us in the studio to shed more light on the demands of the union is Dr. Fayowole Nana. He's a member of the Nigerian Association of Resident Doctors. Dr. Nana, nice to have you join us. Right.
Thank you for having me.
Good morning.
Right. Now, strike, threatened to go on strike. All right, we're now on strike. You know, the last few years, there has been a back and forth between your association and government one way or the other. But now your union is on strike. Now, besides the some of the demands that you have made that I have read, can you walk us through some of the grievances that the union has?
Okay, thank you so much. Our demands have been very clear, and it's been out there for a couple of weeks to months. And in fact, since January, we've been making almost the same demand. And these are things that had been on for quite some time. And one of them was one-for-one replacement of clinical staff. And then, you know, with the 2020 experience of COVID-19, it was shocking that even very senior government officials were telling us that they didn't know that the health system was in such a mess. And so we felt that with that, we probably will see more energy towards improving on the healthcare system. But then, and we also are faced with enormous brain drain. And there's a presidential committee on brain drain that was set up. They have submitted their report since February. All that is needed was a circular to be released to empower the CEOs of different hospitals so that as persons are leaving, they can also be replaced, because it's telling on those of us who are left behind, because everybody will get to a breaking point and say, I can no longer continue. And then how much of that can we take? So just bring this. This doesn't have to do with any monetary, just bring out the circular to empower them. Currently, in some institutions like mine, OHAC, and also you say they're on strike, even before now. Just because doctors have been working for 7 months without being paid, because the duty of the CEO is just to keep the hospital running. How do you keep a hospital running without doctors, nurses, and other clinical staff? And if you engage them without the backing from Abuja, they won't be paid. And this harsh economy then becomes a problem, keeping people who are not being paid for months. A very hungry doctor is a very dangerous doctor. And one of us things we also demanded is a payment of 2023 medical residency training fund. This has been budgeted for. In fact, even prior to now, all we're being told was that, okay, let's wait, let 2023 appropriation be starts to run. And we waited, and June came, and the next thing we're hearing, okay, it's budgeted for. It is not as if we are looking for money elsewhere, and we're looking for something extraneous. But we felt that these two are some of the things that they could just quickly wrap up. And we also know that our colleagues in the state are having all sorts of undue stress, even higher than what we experience in the federal teaching institution. Luckily now, I think we've seen some good signs from the chairman of Nigeria Governors Forum and the governor of Kwara State, and then I think Ogun State is following suit. We want that replicated in several, because even some of the things we are talking about have not even been approved at the state level. So medical resident training fund, a whole lot of states are not even enjoying that. In fact, the reverse comments, they're not even enjoying that. Even hazard allowance, they're not. A whole lot of states have not started enjoying that. And we also felt that we need, the last time the consolidated medical salary structure was reviewed was in 2009, implemented in 2014. And there was a part that every 5 years it should be reviewed. Up until now, it hasn't. And that was why we came up with our demand. And we're looking at parameters in terms of cost of fuel, cost of living, inflation rates, and then forex exchange. And then we run the figures. And that was why we came out with our 200% demand. Even when, after the removal of subsidy, this thing went up. In fact, at the last meeting, our calculation around the figure again was around 550% to even take us back to where we were then as of 2014. And the truth is that the money I earn as a medical house officer is way more than what I'm earning as a very senior doctor. If I'm going to be, the purchasing power is lesser. So that's the reality. Take us back to, we're not even asking of increase, take us back to where we were in terms of parity of pay. We aren't getting that particular, and not coupled with that, the fuel price has jumped from 500 as of last time we were talking about 550 to 617. I'm sure if we run the figure, people cry again that these guys are just,
But you still need to, explain some more, on what you've already, talked about, because some people listening to you would say, yes, but then we are all affected, somehow. But, help us understand the peculiarities of the medical, profession, through government physicians, government doctors. You've spoken about some peculiar allowances, you've spoken about CONMESS, the hazard allowances and all that. All these you say are pending. And then you also give an interesting point of, now that you are a senior officer in the profession, your take home or your monies, are, way lesser. Though you alluded to, purchasing power, the state of the economy and all that, but just what makes the medical profession, so different, or what makes them stand out?
Okay, thank you so much. The truth is that we are considered as essential worker on paper, but in reality, we are not treated as essential worker. The truth is that with the current reality, removal of subsidy, we've seen interventions from different governments. Some say come to work 3 days in a week or alternate days. But as a doctor, I can't do that. I have to be at work every time. In fact, there's no limit to the number of hours I'm supposed to work as a doctor in Nigeria. So I'm probably, it's an offense for your phone to be off. Even if your battery runs flat, you have to find a way of charging it.
Are these best practices?
This is not best practices, but this is what we have to cope with, and that's why we're having this burnout of the few of us that are left. And if we not get to this situation, it makes it a lot difficult. And you spoke about peculiar allowance. It didn't even apply to us. It didn't apply to us. All we needed was that this review of CONMESS ought to have happened 5 years from when it was implemented. It wasn't done. 10 years down the line, it still hasn't been done. And we are here still trying to push and trying to give consensus, trying to understand with government. But then it doesn't seem these things are taken seriously. And more so that we're having pockets of diphtheria outbreak here, anthrax here. And then, in fact, when we saw that, okay, there was even a proposal now, 70 billion to National House of Assembly, 35 to judiciary. And wait, health was not even there. It was alarming that, okay, well, maybe health is not even a priority right now, man. I think if health is not on the priority list, it calls for worry, because a healthy nation is a wealthy nation.
All right. We hear that in the government is planning to increase budgetary allocation to health by about 10%. Anyway, we'll wait to see how that is going to come up. But share with us the level of engagement that you have had with the government and what they are saying or what they have said so far that you are not satisfied, that still made you to go on strike.
Okay, thank you so much. We're a very reasonable association, and our members are very reasonable. So I think the attitude of government is just what is worrisome. Because when you put out a notice, and the notice is coming from an essential group of workforce, then you pay attention. Guys, come, what are the issues? But what we see is that they wait out the whole ultimatum, and at the end of the ultimatum, we now start seeing come to one meeting, and without any seriousness in terms of plans on the table. So it was becoming really annoying, to be sincere with you. We gave, from 5th of May, we gave 2 weeks ultimatum. The whole week, the ultimatum elapsed on the 19th. We only had the first meeting on the 17th. by the Permanent Secretary Minister of Labor and Employment. And it was just more like formality. Nothing serious was brought on board. In fact, even before the last government left, the Honorable Minister of Labor and Employment, Dr. Grievances, scheduled a conciliatory meeting where all the permanent secretaries of all the affected ministries were the signatories to the last MOU that we signed. He knew that we'll be leaving, and so he engaged the most senior civil servants. And up to now, all of them are just acting as though they're not even in the know of what of the things that are happening. We had given enough. In fact, after that 17 meeting, we had a meeting with a high-level government official, I think the SGF, on the 20th, because we couldn't call our emergency extraordinary NEC meeting because we felt that let's just still give time. We kept pushing, kept giving more time, and he said, "Okay, well, let's give us." In fact, it was one that said, "What can we do to avert this strike? Just mention one or two." And that was when we came that, okay, just one-for-one replacement, it costs nothing. MRTF 2023 replacement is being budgeted for. It's not as if you are looking for money somewhere. If you do this, I can then go back to our members and say, come, we have the ears of a very senior government official who is listening to us, and we will do this, then the line of communication or engagement then will be open for others, which can be in days to weeks. But then, when we saw that also fell flat, we felt concerned, and it's very difficult calming a very angry member, because we are leading a very cerebral group of people. I need to convince them. I'm not just a national officer. I have to bring the fact, and I'm not talking to fools. They need to question the validity of what I'm saying, and that is where our issues are really.
You spoke about a presidential task force on, set up to tackle the issue of brain drain, vis-a-vis the one-for-one replacement, which is also paramount in your list of demands. But not much is known, so to speak, about the recommendations of this task force. And I wanted to clarify some issues. The recommendations, that is, because you said that is also pending. It's just there in paper. And in terms of the practicability of the recommendations, I want to believe that the task force and your body must have been engaging on this issue of engagement. So to what extent are these recommendations practicable, and why are we not talking about it? Why don't we know about it, and why is it not working yet?
Oh, well, what happened was that the committee was set up to just look into how to stem the brain drain issues, and then they only came up with the recommendation. And I think one of the things that we extracted from the recommendation, because it wasn't submitted to us, was submitted to the civil head of service, right, because they're supposed to make circulars to that. I think what we extracted from, because we also want the system to work, that out of what they have recommended, I don't know how many list of items or things that they've recommended, but then what we know that is part of the recommendation is that at least if people are leaving, because one of the things we put out is that if a doctor or a nurse leaves now, it will take nothing less than 6 to 8 months to even try to even replace, because of the bureaucracy of waiver system. And if you don't have waiver, if you recruit, you're on your own. And that is the reality. So if people are leaving, in order to allow the system to work and not allow the poor masses to suffer from lack of doctor or nurses to see them, that there should be a way, a special waiver, so to speak, so that as they are leaving, the CEO of different institutions can say, okay, so doctors and nurses have left, I need to replace them with this number. That's why we know that we have dearth of people, but then if you have willing people, because if you have willing people on ground, we shouldn't even still be owing. Those that have been recruited now who are not being paid, it's because the hospitals wanted the system to work, but they haven't gotten the approval to even get them, to even employ them. And when they do that, then they are now on their own. They can't pay them, and then we have internal issues on our hand. And that is actually what the issues are. We just want the system to run. Let the people who are still willing to stay back to work be engaged. Even if as still that we don't have enough doctors, there are still a couple of doctors roaming the street who are not being engaged. And that appears abnormal, really.
Well, as it is, Nigerians have been reacting to this since the news came out, and Some said that the timing could be inappropriate to some extent because this government is just coming in. They're just trying to settle down. There's no Minister of Health yet. There's no Minister of Labor and Productivity, as the case may be, or, to engage you, all of you directly. And the government is trying to look at what can work based on the budget that was handed over to them and all of that. Was all of these considered as a way of at least giving this government some benefit of the doubt, giving them some time to settle down before all of this is put in place?
Usually, before we come to conclusion in our meetings, usually very rigorous thinking and deposition from members across board. And I think if you recall that when we had the warning strike in May, leading towards the inauguration, we had to share with that, okay? But then that was enough consciousness, enough awareness to the incoming. And by the way, all of them, all the major political party candidates then campaigned on their policies around health. So that was, we shared that okay, it was just going to be a warning strike. At least the people coming on board who probably are aware. And when we had our ordinary general meeting in Lagos, we also, in our congratulatory message to Mr. President, we also alluded to the fact that we are also respecting the fact that it's just coming on board, and then we are giving this time. Because we wanted to have a decision as of May, but we shelved it that, okay, 2 months after, we are here again, and still no decision. As I said, and then we're not even going from one party to the other. It's still the same party, really, and then government is continuing.
Yeah, of course, that is considered, but as much as it's the same political party, but the persons who are coming in, you would agree that one way or the other, you need to be briefed, because if you are not the one in charge, you cannot have all the information that is needed. A new person comes on board, it's still the same political party, but you need all the briefing so that as you take your decisions, you take them well in such a way that they fit into the agenda of what should be. Between May and now, some persons may argue that you don't have much difference yet because the cabinet is not in place. Government is still, looking into all the areas they need to look into. The president has just made, an appointment of about 20 officers yet. Others are still on board, and so on. May and now, some people will say you don't have much difference yet.
Oh, well, the truth is that the cabinet we are waiting for are politicians, and they are the prerogative of the Mr. President. So we have career civil servants, and the permanent secretaries are at the top of that list, and they are still there. All you need is guidance. In fact, at some point, this action was actually preventable, because the things we put, in fact, at some point we reduced just to avert, just approval for this, and then let this circular come out. Just those two were, in fact, that was what we told the speaker when we met with him. That's what we told the SGF. In fact, it was the SGM that started it because they demanded that what can we give to avert this. And we're sincere. We hope that if we have this, then we can go back to come. With this, I think there's some commitment. Let's see, let's give more time. But then we didn't even get what could be used to avert the strike, and so unfortunate.
So the one thing that you told the SGF has to do with, can you name the particular things, the items on that list that you gave to the SGF?
It was just payment of 2023 MRTF and one-for-one replacement.
Okay, for a start.
For a start.
And what was the response?
Well, he asked us to give him 24 to 48 hours. That was going to meet with Mr. President, and then he will probably get his approval on those things that are briefly there. The permanent secretaries have presented them. So it wasn't as if anything is extraneous. It was just what has been there, just awaiting some sort of approval. That was just it. And then that was since 20th of July, and then here we are. I think we've given more than 48 hours.
All right, but talking about impact, and yes, impact is such a broad term. Impact on the people, and even impact on this very popular language. That is we can all relate with here in Nigeria, in this part of the world. the question has been asked when ASU embarked on the more than 9 months strike. The question was also asked, and I also want to ask you to reflect some of the perspectives from onlookers. Has it worked? When I look at the demands, some of these demands appear to be recurrent demands, over the time. And you've also spoken to that nothing appears to have changed. That is why you are embarking on this last option. But if you could weigh the effect of, this industrial actions, being embarked upon by your union, over time, do you think is it worth it when you measure the impact? How far do you think you've gone?
The truth is that it's usually a very difficult decision for us to decide to embark on any industrial action. It's about the last resort. And the truth is that because nothing else has worked, we are engaged. In fact, to even get people, we present ourselves, we're always available to engage, but the people you are supposed to engage with are not even interested in meeting with you in the first place. And so it begs for question that where's the sincerity of people who are leading us? And that is where the problem is. And when you can only be pushed at some point when you are pushed to the wall, and then for us, because at some point when there are issues, most times it is now your personal problem and then the defense of your license. Because I can't be hungry and I will feel safe. And the patients who are coming to the hospital, once they say, doctor, they don't know for how long he's been working. And nobody cares. And they don't even know whether there are facilities to attend to them right there. So they want the doctor to solve. Sometimes the result is one of the reasons that why we have violence on our members. Because he said, okay, you come to the hospital and say, there are no even bed spaces to admit. And somebody is bringing an emergency. Do you put the patient on the table? And if you're looking and see if you're not trying to help, they descend on you. And we just put ourselves in harm's way unnecessarily. And that is not what we did. In fact, it was until 2020 COVID that we realized that even a very top person didn't even know that the hazard allowance was 5,000 naira for all health workers. And even the increment is being totally nullified with all of this inflation and fuel subsidy. I'm sure the 5,000 of then was even better than what we currently, and in fact, there are people who are still being owed arrears, who are missed out. And imagine, okay, common sense, people are missed out. These are the list of people missed out. Just pay them. It's as if people are just bringing in names from Jupiter. But then, unfortunately, this seems to be the only thing that even gets them to even want to do anything or to even have a seat with you. And that is even unfortunate. If you can.
All right. So as it is now that the strike has started today, has there been any statement from government or any move from government to reach out to say, okay, fine, let us talk so far?
Well, the strike started at 12 midnight, so up until now we've not gotten, but then we're always available and ready. At any point that we are called, we'll show up.
Some people say that if you look at the list of demands, that the resident doctors seem to be just all about themselves rather than maybe the system and so on, because there wasn't a talk amongst all the demands, there wasn't a talk about the state of the hospitals, equipment, and so on. It was just about the salaries, it was just about the welfare, it was just about accruables and benefits and so on. What do you say to that?
It goes to show that probably the fight is more of an existential threat to us. Because if we bring that on the table, it's going to be a very terrible situation. In fact, I was consulting in a room and the patient came in and after just finding herself with whatever she was holding. And I just laughed and I spoke to her, but you are not the first I'm seeing today. I've seen several and this is where I am. In my ward coat, I even have ward coat on. So if we take all this structural decadence in the hospital, that's, in fact, we're just fighting for our own survival first. Because if you take on that, that's, I don't know, that's a very difficult one to take on.
All right, we have to leave it here. The average Nigerian or the average patient who needs your attention is the one we're trying to imagine what they could be going through at times like this. But we hope that there could be some resolution somewhere for all of you to go back to work. But we thank you for all that you do. And Dr. Fayowole Nana, a member of the NARD, thank you so much for your time.
Thank you.
Thank you for having me.
Great.